Hi friends, welcome back to Smile Nursing tutorial. Just today we are going to speak very briefly about partograph. Actually, the partograph is a tool that can be used by midwifery personnel to assess the progress of labor and to identify when intervention is necessary. By using this photograph, we can easily identify the complications from prolonged labor for the mother, that is postpartum hemorrhage, sepsis, uterine rupture. And for the newborn, we can identify death, anoxia and infections. Actually, the partograph must be started when the patient is in a labor and in active phase of labor, that is 4 centimeter dilatation. Next, coming to the uses of partograph. We have to monitor all stages of labor of all women arriving at the maternity or health facility. To monitor the progress of labor like cervical dilatation, descent of fetal head and uterine contractions. Next, to monitor fetal conditions like fetal heart rate, membranes and liquor and molding of fetal skull. Next, to monitor maternal conditions like pulse, blood pressure, temperature, urine, drugs, IV fluids and oxytocine. To assist in making the correct decision about transfer, cesarean section or other life-saving intervention. Now, we have briefly known about the partograph. Next, we will speak about mechanism of labor, LOA and ROA. What is mechanism of labor? The labor is the series of passive movements of the fetus during its phases through the maternal pelvis during labor. Next, what are the principles of mechanism of labor? Descent takes place throughout labor, whichever part leads and first meets the pelvic floor will rotate forward until it comes under the symphysis pubis. Next, LOA, left occiput anterior. Lie, longitudinal, presentation vertex, position LOA, attitude flexion, denominator occiput, presenting part, posterior part of the right parietal bone. Next, descent. Descent takes place due to forceful uterine contractions and retraction, rupture of membranes, complete cervical dilatation and maternal efforts. Coming to the flexion. Flexion is increased throughout labor. The increased flexion will decrease the presenting diameter, that is suboccipitofrontal 10 cm to a smaller diameter suboccipitobigmatic 9.5 cm. The occiput becomes as leading part. Next, internal rotation of the head. In this, the occiput leads and rotates anteriorly 1/8 of the circle to come under the symphysis pubis. The anterior posterior diameter of the head now lies in the anterior posterior diameter of the pelvic outlet. Next, what is crowning? The occiput slips beneath the subpubic arch and crowning occurs. Next, what is extension of the head? The fetal head pivots around the pubic bone while the sinciput, face and chin sweeps the perineum and head is borne by the movement of extension. What is restitution? In this restitution, the twist in the neck of the fetus that resulted from internal rotation is now corrected by a slight untwisting movement. What is internal rotation of the shoulders? The anterior shoulder reaches the pelvic floor first in the left oblique diameter. Next, coming to the external rotation of the shoulders. It takes place simultaneously with internal rotation of the shoulders and the occiput of the fetal head. Next, what is lateral flexion? In this lateral flexion, the anterior shoulder escapes under the symphysis pubis, posterior shoulder sweeps the perineum, and body is borne by the movements of lateral flexion. So, today we have discussed about the partograph and mechanism of labor in LOA. Thank you for watching this video. Next, we will meet with you another video. Until then, bye.